Chapter 4 من كتاب بيتر بانك. Imaging. The management of many facial fractures has improved considerably as a result of advances in imaging techniques, in particular the increased availability and refinement of computed tomography CT scanning and MRI. Although these modalities are widely available in economically well-developed countries, it should be remembered that there are still many fewer advantaged countries where major maxillofacial trauma is common and where most hospitals will still have to rely largely on traditional radiographic imaging. Indeed, plain radiographic supply could diagnose information in the majority of fracture, and they still provide the foundation of imaging. In many patients, they may be sufficient on their own, and in others, they can provide an indication for the supplementary use of other modalities such as CT and MRI. مثلا مستشفى ما بيها هذين الأجهزة، سويت له بلين راديوغراف وبعدين تقول له يابا ترى تحتاج CT، تحوله على مختبر خاص يروح يسوي. Generally speaking, most injuries due to low energy impacts will not require CT scanning as routine, but very few patients will be managed without resort to plain radiograph. بدون ما نسوي radiograph. Imaging in the initial management of a trauma patient. بالinitial management شنو هي الإيميجينج اللي راح نسويها؟ All the clinicians who treat facial fracture will be familiar with the scenario of patient transferred to their care having already had a large number of radiographs taken, often inappropriately prescribed، يعني مو مناسبات وصفهن، of poor quality and of little or no diagnostic value. It is therefore important that all doctors working in accident departments يعني بالطوارئ understand some basic principle when it comes to requesting radiographs of facial injuries. كنت تعرف انت شنو النوع اللي راح تطلبه. Apart from the obvious cost saving, a rational informed approach will also prevent seriously injured patients from being subjected to prolonged and unnecessary imaging to the possible detriment of their overall care. هم تخفض التكاليف عنا وهم تعرض الأشعة هواي. Clinically stable patients. The majority of patients with facial bone fracture have injuries confined to the face, منحصرة فقط على الفيس, and are usually ambulatory or clinically stable, يعني مو معاقين. In this situation, extensive radiographic imaging examination in the accident department is unnecessary and usually relatively non-productive. يعني هو مركز طوارئ بكم حالات تحتاج أشعة، مو أنت تدز واحد حالته ستيبل حتى ياخذ أشعة، فنن بروتكتيف تنتظر على استشارية ثاني يوم. Prioritizing is important, particularly in patients with multiple injuries, and most patients with facial injuries do not need immediate imaging. If a facial fracture is clinically obvious, for instance, a depressed zygomatic or a fractured mandible with occlusal disturbance, it is usually more important to arrange timely specialist referral than to take radiographs. يعني خلي يستغرق وقته ويروح لسبيشالست ثاني يوم أفضل من ما تودي ياخذ أشعة. If radiographs are thought يعني اعتقدنا أنه هي necessary in the accident department, perhaps to identify or exclude a suspected fracture, then a binaural tomograph together with a good quality occipital view will be sufficient to diagnose the presence of most common facial fractures. لأنه احنا bones يعني الراديوغراف العادية تكفينا. If these views show an obvious or suspected fracture, a more comprehensive radiograph examination من أثبتنا إنه أكو fracture أو شكينا أكو fracture في الجهة more comprehensive radiographic examination can be postponed until the patient is under the care of specialist department. يعني من حول الاستشارية والاستشارية يحدد له شنو نوع الأشعة اللي ياخذها شنو الفيوات. multiply injured patients with the widespread adoption of advanced trauma life support. هذا المكان هذا الأتلس صار منتشر كذا بلدان يمكن أكثر من 50 دولة أعتقد. American College of Surgeons and other trauma protocols. It is now routine for a multiply injured patient to undergo a series of standard investigation on admission قبل الانصرفة. This will usually include various plain radiographs as listed بالtable. يعني ناخذ له plain radiographs بالطوارئ. Score radiographs may still be requested in some accident department for patients with evidence of closed head injury. يعني يخافون جماعة النيورو. However, there is no evidence that these plain views alter the management of the patient, and modern guidelines have moved away from this as standard. Whenever a skull fracture or intracranial injury is suspected, CT is now more appropriate. من الشك إنه skull or intracranial injury حولوه CT ما ياخذوا له plain radiograph. Commonly requested radiograph in the assessment of multiple injury patient: chest X-ray, pelvic X-ray, cervical spine view. يعني ياخذوها الصدر وللحوض وللspine. Sometimes collectively referred to as a trauma series. للchest وللعنق يعني الحبل الشوكي أو للحوض. Depending on local protocol, other screening view ما include حسب المكان اللي أنت موجود بيه وتعالج بيه. ثوراكو لمبر فيو ياخذون للقفص الصدري والأطراف. سكول راديوغراف ياخذون للسكول بس السكول بشكل عام ما ياخذوها ياخذون للسباينال كورد. CT scanning of head and torso may form part of the protocol in the management of multiple injury patient. Every effort should be made to incorporate facial imaging into such protocol. In particular, if a patient requires CT of their head and cervical spine and facial fractures are obvious or suspected, they should have imaging of the face at the same time. يعني مو تسوي له فقط للهيد مو بس جماعة النيورو يردون انت هم تسوي الفيس يعني انت already دازة على CT. Imaging modalities. The different modalities available for the diagnosis of facial bone fractures are discussed next before considering the specific imaging required for each possible fracture. البلين radiographs يقول لك راح يشرح لنا بشكل عام بعدين يعطينا شنو السبيسيفيك اللي نحتاجه لكل fracture. البلين radiographs اللي هي OPG I think it has been mentioned previously that the occipitomental projection is one of the most useful screening. من هو occipitomental projection screening views of the facial bones. Unfortunately, in supine patient, this view, along with the posterior anterior view of the face, is often taken in the reverse direction with the tube positioned in front of the face and the film or digital sensor at the back of the head. Such views يقول لك direction reverse. Such views are of little use in definitive diagnosis. All posterior anterior projections are of much better diagnostic value when taken as the name suggests. لازم تأخذ له posterior anterior مو من هو ممدد لازم واقف with the patient sitting upright with the film or sensor in contact with the front of the face. However, depending يعني يكون السنسر الفيلم حاطيه قدام البيشنت قدام وجهه مو بخلف وجهه مو من الأمام للخلف. However, depending on their general status and other injuries, this may not be possible in all patients. لأن إذا فقد الوعي ما تقدرون تاخذوا له posterior anterior. Several views require the neck to be extended and therefore they cannot be taken until the patient is cleared of any cervical spinal injury. من إنه حددنا يابا هذا ما عنده cervical injury يلا تقدرون تاخذون هذه الأشعة. Ideally occipital views should be taken with the patient upright. هذا الideal with the nose and chin in contact with the plate. Two views are usually indicated with the central beam angled at 10% and 30% above the horizontal. This throws يعني شنو الفيوز اللي ناخذهن الانجل 10 درجة أو 30 درجة above the horizontal. This throws the shadow of the dense petrous temporal bone below the projection of the maxillary sinus. البترس مو مال temporal مو كون dense يخليه below the projection of the maxilla sinus فما يظلم هاي المنطقة يصير جواهن فما يصير انظلمات الماكسيلاري ساينس. CT scan كان scan facilities are unavailable إذا ما عندك CT scan أو waters view may help evaluate. هسه احنا قلنا شنو ناخذ أول شي occipital يقول لك هسه waters view may help evaluate a suspected isolated orbital floor fracture إذا شكينا عدة isolated floor fracture وما عندنا CT ناخذ له waters view. This may be regarded as an incorrectly aligned occipital projection. Okay, the central beam passes along the line of the orbital floor, and in this case the shadow of the dense petrous temporal bone temporal bone will overlap the lower aspect of the maxillary sinus. يقول لك بهاي الحالة تاخذ waters view the shadow of the dense petrous temporal bone will overlap the lower aspect of the maxillary sinus يعني ما راح يبين عندك other بس انت تريد orbit floor فما يهمك lower part مال الساينس. Other plane views that may be helpful in diagnosis and treatment planning include a lateral projection. احنا قلنا occipital وللفلور ناخذ waters view اللي هو نفس occipital بس يسمونه aligned and correctly aligned. هسه هنا other plane views that may be helpful in diagnosis or treatment of planning include lateral projection of the facial bones, a rotated posterior anterior projection, lateral projection, posterior anterior projection, and the all too often neglected occlusal and periapical dental radiograph. يقول لك هذا الشيء neglected الأطباء متى ياخذوه بس هو كلش مهم إنه ناخذه من هو occlusal والperiapical dental radiographs. It should be noted that there are a number of traditional views that are still occasionally requested even though they are of limited diagnosis value. يعني هم هذا الشيء شان traditional صار تقاليدهم يطلبوا بس هو limited diagnosis value. These include the submental vertex and reverse stance projection. يقول لك السبمنتال vertex احنا ما يهم احنا ما ناخذ لازم ناخذ occipital مو submental vertex والreverse stance projection هذا قلنا يفيدنا بالزيغوما اعتقد. reverse stance projection يعني limited value من إنه submental vertex والreverse stance projection. It is generally accepted that simple nasal fracture do not require radiographs at all. Simple rotational and linear tomographs. Tomographs are radiographs generated from machines that allow the X-ray film or sensor and the tube to move around the patient. تفتر rotational. The desired plane at the axis of rotation is kept in focus while the remainder of the image is blurred. Rotational binaural tomography orthophantome يعني OBG is almost universally available and is routinely used in suspected fracture of the mandible. هو كل شيء يفيد حتى من يردون يقلعون الwisdom. Tomograms taken with a conventional OBT machine requires a cooperative patient who can stand or sit still whilst the exposure takes place, a requirement that may not be possible if they are intoxicated مخدرين or have multiple injuries. مصاب ما يتحمل. Plain oblique views of the mandible can often be obtained as an alternative, but it is preferable if at all possible الأفضل وإذا ممكن to withhold definitive radiographic examination until the patient is in a better condition. يعني مو تسوي له بالoblique view، لا الأفضل أن تنتظر حتى تاخذ له OBG. Previously traditional indication for lion tomograph of the facial region such as suspected damage to the orbital wall or complex injuries to the temporomandibular articulation have now largely been suppressed by CT. الfacial region مثل damage of the orbital wall, complex injury to the temporomandibular articulation يعني TMJ والorbital walls قبل كانوا ياخذوها OBG هسه صاروا ياخذوها CT computed tomography. CT scanning is now the investigation of choice in the assessment of nearly all significant trauma. يعني هسه احنا ما ناخذ OBG ناخذ CT especially craniofacial injury. أصلا احنا اللي يفيدنا هو CT. Most severely or multiply injured patient will probably require a CT in the early stage من ما severely with multiple injury early stage of their overall assessment, and this should include the facial bones if obvious facial injuries are present. يعني ما ياخذوله بس للchest والبلفيك، لا ياخذوله للفيس خصوصا إذا مبين إنه هو عنده تروما بالفيس. CT technology has rapidly evolved, not only significantly reducing radiation dosage but also reducing the acquisition times يعني time such that imaging of the face is now quite possible as an additional procedure during the assessment of serious head or torso injuries. يعني بنفس الوقت يقدر ياخذ لأن هي ما تاخذ وقت. With newer high speed machines the short extra time required to image the face obviates previous arguments. يعني يغلب الجدارات السابقة that the facial CT would delay intervention and risk in sick patient. يقول لك هو حالته خطر شو تاخذ له CT للفيس، يقول لك هو صار سريع فعادي. If a patient is stable enough to undergo CT of the head or torso they are likely to be stable enough to undergo CT of the face at the same time as well. يعني هو تاخذ له للهيد ليش ما تاخذ له الفيس. This often avoids additional later transfers بدل ما تضيع وقتك وبعدين هم تسوي له إحالة. Transfers of the patient and facilities comprehensive and coordinated treatment planning. يساعدنا إنه نسوي comprehensive coordinated treatment planning. Injuries affecting the skull base, orbital apex and ocular region in particular need rapid identification and CT is particularly useful in assessment of these areas. من إنه skull base, orbital apex والocular ocular region كلش يحتاجوه ضروري. Both axial and coronal views are indicated. Both axial and coronal views are indicated. يعني تاخذ له view واحد، لا تاخذ له axial و coronal. Although CT scanners are now widely available, it should be remembered that the majority of simple facial bone fracture can be diagnosed from a thorough clinical examination in conjunction with conventional radiographs. يعني مثلا المانديبل مبين بالOBG. The main indication for CT of facial skeleton in maxillofacial trauma are given in table. The increasing use of cone beam computed tomography in dentistry has resulted in its promotion as a useful alternative to conventional CT in facial trauma. احنا هسه بالفيس تطورنا صرنا نستعمل CT بعد ما تخدمنا with the claim that it provides good quality imaging with lesser radiation بعد أفضل. This may be true for some dentoalveolar injuries and mandibular fracture, although for most fracture at this level plain views are useful more than adequate. يعني مو إنه تكون كلش دقيقة، المهم إنه إحنا نشوف إنه أكو fracture line For higher level fracture, conventional CT remains the investigation of choice because of superior imaging and greater visibility. بالميدل يعني جماعة اللي 4-2 اللي 4-3 لا الأفضل، حتى اللي 4-1 الأفضل تاخذ له CT، بينما الماندبل دنتو أليفيولر لا تاخذ له CT عادية مو CBC sorry OBG بالماندبل. CT scan of the head, face and neck, possible occult injuries to be excluded. يعني الإصابات الأوكلت شلون نستثنيها؟ ناخذ له CT. cervical spine and intracranial injuries ناخذ له. anterior cranial fossa fracture, intracranial air risk of CSF leakage, complex fracture of frontal sinus, risk of meningitis mucocele, middle cranial fossa fracture around vascular foramina, risk of carotid dissection, aneurysm, globe rupture, vitreous hemorrhage, foreign body, orbital apex, fracture, optic nerve compression. ذني نسوي لهن CT scan. possible occult to be excluded. Main indication for CT in maxillofacial trauma: suspected or obvious fracture of the frontal bone, extensive fracture of the midface, including the nasio-orbito-ethmoid and comminuted zygomatic complex fracture as the frontal وجماعة اللي 4, isolated orbital trauma, displaced condylar neck fracture and complex injuries to the temporomandibular joint. الماندبل body مالته هاي عادي OBG، بس المنطقة الكوندال TMJ no لازم CT. comminuted fracture of the mandible requiring complex repair هنا OBG ما تفيدك، لا لازم CT حتى دقة أكثر. suspected pathological fracture of the mandible هم يحتاج لدقة. viewing CT scans. CT scan data can be viewed on most personal computers using appropriate software. Although high resolution monitors screen are needed for the best diagnostic image. يعني الأفضل إنه high resolution monitor بس إنه عادي يشتغل على الحواسيب العادية. Dedicated facial scans are essential to get the maximum benefits with slices of no more than 1 mm in thickness and preferably 0.5 mm in critical areas such as the nasio-orbital region. شنو هو thickness 0.5. They should be assisted in all 3 planes: axial و sagittal و coronal. Axial horizontal views are especially important to assess the zygomatic arch. هسه الzygomatic arch لازم ناخذ له axial يعني horizontal. nasal septum هماتين orbital apex and medial and lateral orbital wall. من هنا zygomatic arch, nasal septum, orbital apex and medial and lateral orbital walls شناخذ لها axial. coronal views are needed to assess the orbital floor. هاي coronal views to assess the orbital floor, medial orbital wall, lateral قلنا بالhorizontal. الcoronal ياخذ medial orbital wall and skull base. Sagittal views are useful for assessing the posterior extent of orbital floor fractures and the skull base. sagittal يفيدنا بالposterior extension of orbital floor fractures and the skull base. Useful for assessing the posterior extent of orbital floor fracture and the skull base. The skull base شنو هو؟ sagittal. Other areas of the facial skeleton can be visualized by a combination of these 3 views. The computerized data can be manipulated by appropriate software to generate يعني برنامج خاص generate a 3-dimensional screen image that can يعني ناخذ 3 view that can then be rotated and viewed from various aspects to give a picture of the overall fracture configuration that may be easier for the non-radiologist to interpret. يعني انت مو اختصاصك مو أشعة، فمن تسوي 3D image راح تفهمه أفضل من الأخصائي الأشعة. Dimensionally accurate models can also be fabricated، يعني تقدر تسوي لك ملكان from this data if required and costume-made implants or pre-bent fixation plates produced. However, some fine details is usually lost in the reformatting process, and conventional CT slices are still required for detailed radiological assessment. Magnetic resonance imaging MRI. MRI has little if any application in the diagnosis of acute facial trauma. يعني احنا نشتغل على البونز الهارت tissue. However, it can be helpful in the evaluation of cerebrospinal fluid leakage, suspected intracranial injuries and spinal injuries. It may also be indicated for assessing the orbital content and for functional intra-articular imaging in temporomandibular joint injuries. يفيدنا بالديسك. هسه reformed 3-dimensional image generated from CT scans showing a L4-2 fracture type with dental injuries. هسه هنا هذا عنده شكله pyramid imaging for specific facial fractures. Fracture of the mandible include condylar fracture